people join in, and maybe we'll just do a roll call of where people are at. So my name's Nicola. I am the coordinator of CounterAct. We're an organisation that's been going for nearly, I think, 7-8 years, and recently went through an organisational restructure where I used to sit under the banner of Friends of the Earth and have actually become an individual organisation now, which gives us a bit more flexibility because we do support civil disobedience and non-violent resistance work. And one of the things that is, I guess, important to me as someone who's interested in, you know, building movements and communities and non-violent training is that to just expand out people's ideas about what is non-violent direct action, and mutual aid and directly helping each other peer-to-peer is non-violent direct action. You don't have to be working against something. So for us at CounterAct, we'll be looking at doing more webinars, online resources, things like that, so people can do some of the learning that we normally do face-to-face, and try to get creative with using Zoom as much as we can with breakouts and all that kind of stuff. So that's where we're at, and I'm going to introduce you to some of the speakers and some of the other members of our team. I do want to start off formally acknowledging country. So I'm over here on Noongar land, Wajak Budja, beautiful area of the world in the southwest of WA. Walyalap is the Fremantle name for the area. And I guess one of the challenges I would have for you is, if you don't know the name of the Aboriginal land that you live on, maybe that's something you might be interested in finding out. And I think probably most people here do. So I'd love to do a bit of a roll call of people from letting us know what is the Aboriginal nation that you're on, and maybe the English name if it's not like a, you know, a kind of common town that we might not all know. So how about we kind of go geographically in a clockwise way. So is anyone else here from West Australia?
Yep, I am also from Wajak Noongar Budja. Yeah, so Perth, Mosman Park. So.
Yay, welcome. And how did you find out about it?
I was on the mailing list and the webinar sounded really interesting. So I just decided to come along.
Awesome. Oh, well, I look forward to meeting you face to face now that we're in the same town. Anyone else WA side? I'm just looking for hands here. Yay, Sabina and Steffi, and who else have we got?
I'm from WA, so I'm from Wadandi Noongar Budja, which is down in the southwest.
Hi,
Bunbury.
Bella.
Hi.
So Bella is potentially, I think most likely the youngest member on this call, and is basically bringing the demographic down for all of us. So thanks, Bella. Bella, do you want to tell us a little bit about yourself?
I am a school strike organiser. I have written a book about the 17 UN Global Goals for Sustainable Development, and I go into schools and adult conferences and things like that and talk to them about the global goals. I'm co-president of Millennium Kids, which is the group of kids making changes for the environment in Perth, and I'm on a number of different boards.
As you do when you are how old, Bella?
14.
So I've got to double check with the rest of my team, but pretty keen on recruiting Bella into CounterAct if she can spare the time, because I do really think that we need to be supporting young leadership and platforming it, and I'm super inspired working with the school strike kids. Anyone else from WA want to say hi?
Hi, Sabina. It's Sabina. I'm from Wajak Bibbulman land.
Hi, Sabina. Sabina is a wonderful person I've been training with recently. Lisa, you want to say hi? Nope.
Hi, my name's Alicia, and I'm also zooming in from Wajak.
Great. Okay, so I'll just see I caught everybody. That's west. Oh, Katie, yeah. That's west side covered. Okay, so we are going across South Australia. Anyone that way? Okay. I'm just counting on you guys to pipe up. And we are going further east. So where do we land first? Is that on Wurundjeri land? Yay.
Can you hear me, Nicola?
Yes, I can. That's Deb?
It's Miriam. You know me. I know. You.
Well, there's several Miriams, I know. So I'm just working out which Miriam.
Miriam Solomon. I used to be International Secretary.
Hang on, I'm just trying to look for you. Boop, 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 boop.
Well, you can't know. You can't see me.
Oh, okay. No worries. Hi, Miriam.
Hi. Anyway, nice to see you again.
Yes, I recognise the name.
Yeah, we'll chat afterwards. I'll tell you who I am.
Yeah, awesome.
Anyway, yes, I'm the Kulin Nation.
Kulin Nations, okay.
In Northcote.
Who else is Kulin Nations? Yay, hi Katrina, hi Melissa. You guys want to introduce yourselves? I'm actually just I'm interested in the people that I don't know, so might as well meet you all.
Katrina, I'm in Preston on Wurundjeri Woiwurrung land. Lovely.
Hello.
Cool.
We've got Mel.
Yeah, hi, I'm Mel. I am in Dja Dja Wurrung country, so Bendigo, Central Victoria.
Great. And I've got Darren Geraghty raise a hand.
Oh no, sorry, I don't know why it says there.
Oh, that's you. That's just you, Deb. Okay, great. Anyone else Kulin Nations? Great. All right. I'm actually not keeping an eye on the chat, but I'm presuming other people are. Okay, sorry, the one question, intending on using the recording for people that were interested in this, basically, so we will share it through CounterAct channels. People can ask me questions about the recording later if you like. Certainly won't send it out if there's any concerns. Okay, so going east, where else? Who wants to wave at me?
Hi, I'm Frances. I'm also from not far from Bendigo on Dja Dja Wurrung country.
Great.
I haven't got great internet, so I'm just on audio.
Awesome. Welcome, Frances. And yep.
Merryn.
Hi, Merryn.
I'm also on Dja Dja Wurrung country. Hello, just in Sedgwick, which is just sort of north of Bendigo. Hello.
Hello. Very good to see you, Nez. Oh, Alex, I love it. You're multitasking. Did you want to introduce yourself, Alex?
Oh, hi, I'm Alex. This is Quinn. We're in Castlemaine on Dja Dja Wurrung country.
Great. And I think is that covering Vic, Sydney area, Eora.
Oh, no. Hang on, sorry, yeah, no, Lorraine, we're in Jerry. Yeah, I'm in Reservoir in
Lovely.
Reservoir. Yes. Hi.
Resume.
Yes.
Okay. All right. And quickly over to.
Can I quickly say hello?
Yes, please.
Head over. I'm Deb. I'm on Wurundjeri land. I'm in McLeod. Hello, everyone. And thank you so much, Nicola, for organising this.
You're very welcome. I normally wouldn't do a, sort of complete name round on a call this big, but I actually just think right now I want to know who I'm talking to, and I think a lot of us are feeling disconnected and very isolated. So yeah, I just to let you know, that's a kind of a deliberate decision to get people to know who they're talking to a little bit and where we're all situated. And so we're going further east, Eora, Gadigal. Where are we at? Yeah. Anyone want to say hi?
Yeah. Hi, I'm Serena. I'm from the Blue Mountains, which is Darug, Gundungurra land.
Great. Hey, Serena. Mim, hello. Thank you for joining us.
Hey there.
I'm happy to say hi. You go then.
Flicking between screens. Maybe we'll go Mim and then whoever that other voice was.
Hey folks, Mim here on Gadigal land.
Yep. And someone else had their hand up.
I'll go, Nick. It's Larissa. I'm on Gadigal Bidjigal land, which is Bondi Beach.
Great.
Hi.
Yep.
Oh, sorry.
That's okay. Go,
I'm
Peter.
Peter. I'm also on Gadigal land in Sydney.
Lovely. Anyone else?
Hi, I'm Meg. We're going a little further south in Canberra. I think there are a few of us from Canberra.
Great.
And I'm Meg. This is Marilyn.
Hi.
We're in a, I heard about this through the Dixon Downer coronavirus mutual support group, and handed the idea on to a number of other members of a chorus of women who are also with us.
Awesome. Brilliant.
Yeah, I'm another in the same place.
Hi, Caroline. I recognise you.
Yes, yes.
I'm Janet Salisbury. I'm from Canberra, and it's Ngunnawal in the Ngambri country, and I'm a friend of Meg and Marilyn, who has just spoken, member of a chorus of women, among other groups here in Canberra. Yeah. Hello.
Excellent. And
I'll just say hello to, I'm also with the chorus of women, and heard about this from Meg. And yeah, so I'm with a couple of other sustainability organizations here in Canberra and so on, Sea Change, etc. Yeah,
awesome.
That's my background.
So I've noticed
Kaveri, and I'm on Ngunnawal land and Cook in Canberra.
Great. I've noticed that Canberra seems like they've got some really good systems. So we've sort of got some people lined up to speak, you know, deliberately. But then I kind of do want to open it wide up to hear from people from different groups about what's working and what's not. We've got Miriam on the line. She's from Get Up. They've done the viral kindness site. And so she's really interested in, you know, she'll explain that. She's interested in hearing about, you know, kind of what groups need and, you know, how we can connect people better. Chloe might be joining us, who did the neighbours next door. Next neighbours. I'm sorry, I can't remember the actual name. I'll post it in. And then like we've got Serena and a few other people, Alex, that are doing already doing this kind of mutual aid work. So I think we've got a spectrum of people who maybe haven't done it before. Is anyone here who is not done specific outreach on Corona in this particular area? Anyone who hasn't done that yet?
Done what?
Done any mutual aid work, so like seeking out to help like your neighbours, or directly outreaching to people, or knocking your street, or participating in, you know, Adopt a Health Worker or any of those groups? How many people?
Yeah,
how many people are new to it?
Yeah, I'm new to it. Yeah.
Great. Okay, and could people raise their hands? I'm just kind of flicking between screens. I know I've just a little bit brain dead today. So have forgotten some of my tech skills. Great. Okay. And then how many people are active in active mutual aid groups right now? Okay. Great. All right. That's really interesting. So we've got a really good mix. That's exciting. Okay. Well, oh, sorry, hang on. I forgot the rest of the north of the country. Anyone else want to say hi who doesn't live in the sort of southern areas? Katie, Stephen. Where are you, Stephen? You need to unmute. So I'm going to do this signal for when I can't hear people and you need to unmute.
I'm unmuted now.
Say again?
Oh, hello from Burgermeister land, on the mid-north coast of New South Wales.
Great.
Yeah. I'm living in Brisbane at the moment, even though I'm from Wajak Budja, but I think it's Turrbal land that Brisbane's on.
Yeah. Turrbal and Jagera, I think, are I think it depends where exactly. Anybody else? Daniel and Kane. Daniel first.
Hey everyone, Dan on Larrakia land up in Darwin.
Yay, North Side represents. Awesome. Fiona.
Hey, yeah, Fee on a Wabical land, Newcastle. Nice to
Fee.
see some faces.
Yay.
Hey,
And
hey,
Kane.
Stephen.
Yep, came from Yucca Bay Land in the Gold Coast.
Gold Coast. What's the country there, Kane?
It's part of the Bundjalung country, but the specific area is the Yucca Bay area.
Yucca Bay. Cool. I love learning new ones. Paul.
It's Paul Costin from Marwanina land in Hobart, Old Beach in Hobart, Tassie.
Great.
So if things get really rough, we're the West Islands of New Zealand.
I would be like trying to swim there. I think everyone just wants Jacinda to be our Prime Minister. Hey, Lynn.
Hi, Lynn here from Wonnarua country in the Hunter Valley. Hi, Fee.
Great. Anyone else want to say hi? All right. Well, that was a lengthy round of intros, but I'm actually really glad to have met you all. And if any of the folk want to speak who are on the phone, just use the hand indication. And I might just get Jessica, who is my co-conspirator at CounterAct, to keep a watch on the chat screen, if that's all right, Jess. That would be grand, and just draw attention if there's anything I need to deal with. So I do want to, oh, have I got Alex saying she needs to go? Sorry, I'm just double checking a couple of messages.
I'm happy to do that, Nick, so you can...
Yeah, that'd be great. I think a few people have private messaged me, so when one of the speakers, I might actually just hand over to you shortly, Jess. I did want to make sure that both Alex and Cara had a chance to talk early.
Alex has sent his message to everybody, so yeah.
Her message? Alex Kelly?
Yeah, Alex's message has come through to everybody, so we can all read that.
Which was they need to go?
Yeah.
Okay, cool. So if she wants to come back, that'd be great. She's been doing work in Castlemaine, and she had some really good story of feeling like she was moving to a new place and able to really connect with people. And this actually just providing this kind of like whole open opportunity to do that. So I will message her and see if she wants to pop back in for 5 at some point later in the discussion. So yeah, I'm not going to talk a lot about mutual aid. I think it has got a lot of meanings to different people. I think what we want to focus on at the moment is just like, what does practical community building look like? And one of the things that I will note is that I've been working in the climate movement for a long time, and there's been some really unhelpful comparisons between coronavirus and the climate movement, and you know, that humans are a virus, and that it's really great that environment is getting a break. And there are some articles that I will share in follow-up with people that have really outlined the problems with that kind of leaning towards eco-fascism a little bit, as some people have phrased it, in that I think that it's very dangerous for us to compare the two things. We don't necessarily want to relate the kinds of things that we want to see in the world to like massive, horrific deaths and in the thousands across the world. And so just to be a little bit mindful of that when people are talking, if you're working in that particular sector, I think. What I do see out of this, the only thing that I want to relate climate to is that I believe that this is an unprecedented opportunity for us to actually build community in a way, like we've just had this open door really to connect with each other in a way that we've never really done before, certainly as kind of like a white Western society. I do want to acknowledge that I'm not aware of any Aboriginal people on this call. It's not for want of asking, but it was very late notice, and so I'll again mention some resources in follow-up. Like actually doing this deliberately comes a lot more naturally to a lot of other cultures around the world, and we've lost a little bit of a sense of that in a lot of sort of, you know, more white Western societies. So building community, I think that will help hold us and open up doors to like resilience and framing the society that we want, being on the front foot and talking through this crisis about what we want is a really, really huge opportunity. And whilst it's going to be horrific what we're going to go through, I think that piece for me is the only salient point to do with the climate, you know, apart from, you know, it is nice that, you know, there's going to be some break in you know, some of the industrial pollution and things like that. But I don't think that's something to be celebrated. And we don't want people to associate a just climate future with closure of everything they want to do in their lives. So I think that's actually something to be careful of when we're all talking about this stuff, because I know I'm just recognizing a bunch of faces from people I've worked with in the climate movement. Tiny little housekeeping thing that I forgot at the beginning. If we can't hear you, we'll do like a little ear signal. So just like if you're on mute and you're seeing a bunch of people do this and you're trying to talk, that's reminding you to turn your mute button off. I don't know if anyone's got an online bingo card for calls, but that tends to be one of the favoured problems. And for people that have seen people doing this, that's it's used as kind of like a way of indicating that you agree with something, and it's also an Auslan clap. So you're basically, while you're on mute, actually saying like, yeah, I actually really like that. And as a facilitator, I find that helpful, and some of the speakers might find that helpful if you want. But we might unmute at some point to clap for people if we feel so inclined. Okay, so I might hand over to someone first who can give us a bit of a story. Cara, just letting you know to hop yourself off mute in a second. So Cara is someone that I've known for a while and worked together with on a few different projects. We've done some work on really exciting, I think, and really needed work in the climate movement, in the Women's Climate Justice Collective. And Cara has been doing community organising for a short time, but she's also more recently like knocked her street. And I just wanted to, each speaker will hear from for 5 or so minutes, and then we'll do a big round of questions and open discussion at the end. So I want to open the floor for Cara.
Hi everyone, I'm Cara. So I basically just used a letter template, which I think Michael Polsford wrote up, and which I'll share in the chat, and just printed out a bunch of letters basically saying, hi neighbour, I'm Cara, I live on the same road as you, and I think it'd be great for us to have a way to communicate, without being face to face. I've set up this Facebook group and I put the link in there, and I also gave people my email and my phone number in case they didn't have Facebook, but that's totally fine. Feel free to reach out. And I went letterboxing on Wednesday. I've got quite a long road, so my partner drove and I stuck things in letterboxes, and it was great. I wasn't sure of the response I'd get, but I think I've got 30 people or something in the Facebook group now. Everyone started introducing themselves. It's been really, really lovely. I've got a few phone calls from people, like really positive response saying this is such a nice thing to come out of a bad situation. I've got text messages from people saying the last few weeks have just been really stressful and they haven't been feeling great, and then getting that note in the letterbox was something really positive and made them feel a lot better about the situation. I think like even if people don't end up using the groups, even just the action of receiving something nice in your letterbox from someone in your neighborhood saying, hey, I care, let's connect, is just sending out those ripples of kindness and connection around, which I think people sort of really need at the moment. But the Facebook group's been useful already. Like someone couldn't find their cat and we found their cat. People have been like offering to share like excess food that they've got. And in fact, one of the people that called up to talk to me about it was like, this is going to be really useful in the bushfire season because we're on a mountain. And often, we don't know if everyone's left or if someone's at work and needs their pets picked up or whatever. So I think this group's going to be really useful, for ages. And I think it's one of the great things to come out of all this.
Great, Cara. Did you want to, I guess I'm interested in hearing a little bit about any of the barriers and, what people found approachable in terms of the tech. How did you talk to older people in particular? I know that we've got lots of obviously savvy people on this call who are, you know, of all different ages. Actually, it's really great to have such a good mix. But yeah, what are some of the learnings?
You know, it's been surprisingly easy. I expected a lot more barriers. I guess the biggest barrier for me was just because I'm on a really long road and actually delivering all the letters. But as I said, my partner just drove along and I dropped them off. Almost everyone, like I've had people call me who are a bit unsure about the Facebook group, and I've just talked them through it. You know, they've said, oh, does this mean everyone can see my profile? I want to stay private. I'm like, no, it's okay. Like, just see what people have made publicly available. You can just be a passive viewer of the group. You don't have to contribute if you don't want to, and just talk people through it. But a lot of people are pretty familiar with Facebook and Facebook groups. I thought if I got a lot of feedback or calls or emails from people saying they don't want Facebook, I would set up a WhatsApp group as well, which my sister has in the UK. Her community set up a WhatsApp group. That might work for some people. I think Facebook groups, someone asked me why I chose a Facebook group as opposed to a WhatsApp group. For me, I like Facebook groups because you can create topics and you can tag posts under topics. So it's a lot easier to search for, like, you could have like a needing help, you know, topic and a offering help topic or an introductions topic or whatever, and then people can search through those. It's a lot easier, and you can have threads, like you can start a post and people can comment on that on a specific topic, and just it's a bit neater, I think, and a bit easier. You can have announcements and pin them to the top so everyone has to read them when they come on. And yeah, I think it's easier to view and keep topics separate than in a WhatsApp group where things can get lost and you have to scroll forever to find them. So but other than that, like, I really haven't had any barriers so far. I can't complain.
That's great. And what's the mix of people on your street?
We've had a few different age groups. I mean, I have to say the main people that have jumped into the group straight away are people sort of in their probably like 30s, 40s. I guess a lot of people have Facebook and that was sort of like prime Facebook age, people in their 30s and 40s. But there's been a big range. I mean, probably the youngest so far has been in their early 20s up to people in their sort of 60s, 70s. But it's just been lovely, everyone introducing themselves. Like, everyone's putting up photos and saying, hi, this is me, this is my dog, blah, blah, blah. Someone's a nurse, someone's a heart and lung specialist nurse, and she's like, if anyone gets sick, I can come visit, you know, I can give you advice. It's like, wow, that's pretty useful to know.
Yeah.
Good for businesses as well. Like, even people are saying, like, my partner's a carpenter. It's like, oh, I didn't know I had a carpenter just down the road. Like, I think it's going to be really nice to keep work local as well in the future. Be good.
Yeah, I'm really liking that one. I do, like, later in the call, I'm going to call on Bella, because I think that younger crew, you know, like, they're using Insta to connect. And so if we do genuinely want to have like a diversity of community, Facebook is the default for sort of lots of people who don't have security concerns. But yeah, interested in how we like really make sure that we're, you know, keeping it open for everybody. So yeah, it'd be good to hear different kind of perspectives on that. The other thing just on the health workers is that I did ask for someone in the group if they could come and speak, but I think they're just so overwhelmed that they're like a very small idea, you know, went huge, as lots of these things do. And just wondering how many people have seen the Adopt a Healthcare Worker. Not a few people. Yeah, so I'll share a link on that one. I have adopted a healthcare worker, so I'm interested in hearing from other people today, but just a few of the little things that I've done is we've been meaning to do it anyway, but we've set up a Facebook group for our flats, so there's 36 people here, and on Neighbour Day tomorrow I'm going to bake a bunch of cakes. I've been baking cakes for a couple of healthcare workers and offered direct support to a friend, done some grocery drop-offs for a local auntie, helped out the healthcare worker when she couldn't kind of get to the chemist, and I think a lot of people just like the logistical errands. These people are quite overwhelmed and, you know, on these really long shifts. So, you know, you might choose that that's the way that you want to engage. And Merryn will obviously have some good feedback for us on that as well. So I also do want to acknowledge, I don't know if there is anyone else who's a healthcare worker on the call, and if so, you know, would love to hear from you. But I asked a bunch of friends who are in that sector if they were interested in being on the call, and you know, a couple of them are really not doing that great. And one of them's really quite overwhelmed and she's really scared. You know, she's, a lot of the deaths have been people who are literally on that front line, and it must be really, really devastating to see people not taking the physical distancing. We should all try and use that phrase, the physical distancing seriously. And yeah, that was actually like, I want to be honest and keep this a space for people that can reflect emotionally if you want to. That was actually my point last night, is actually getting that text from her. And that was my kind of like, my point of kind of getting the reality of the situation, as well as seeing the, just like the images of the funerals, what's allowed at a funeral, and that people aren't allowed to hug each other at funerals. And there are chairs just placed, you know, a couple of meters apart. And then in New York, I saw a picture of a fridge, a massive refrigerated truck that they'd had to bring in to store the bodies in. Hearing about hundreds of people who've died in Iran because they've drunk methanol, thinking that was going to kill the virus. It's just, yeah, it's really big. I just want to say that to everyone, an open space for people to, yeah, to sit with the fact that we're going to be going into a really hard time. So I would like to introduce Merryn, who's a friend from way back where we met on Sea Shepherd actually together, and I've witnessed her sewing eyebrows up at in, you know, 5 meter waves. She's quite the all-rounder. We've worked on climate together as well. So Merryn's the doctor, works with young'uns in particular. And I'm interested in, for us, I wanted to have Merryn on the call so people could kind of reality check their ideas on, like, is this safe? Like when we get to the point of thinking about some of the logistics and how we're mapping out different pieces of work. But also just Merryn's experience as a doctor, some of the things that we want to look out for while we're doing the mutual aid work, and any particular things that you think are useful that we can be doing to support the health sector right now.
Thanks, Nicola. Thanks so much for organising, and it's really great to see how many people are interested and have taken the time to come on. I'm a paediatrician. I work in a community health service, and we actually we're in a position where we're able to change over to telephone and video consults for most of our patients, or rather we've made the decision to do that for the safety of everyone involved, essentially. And then we're going to work out over time whether or not we do some face-to-face consultations if that's needed for assessment or follow-up of our patients. So I think we're in a lucky position that most of our work probably can be done that way, whereas obviously in emergency departments and on hospital wards, there's absolutely no alternative to be face-to-face. And I think it is really frightening. I think it's really frightening for healthcare workers in that setting. I know even our reception staff and our admin and our staff, while we were waiting for this process to do the changeover, you know, it just was a really kind of quite frightening time to have people sort of, you know, walking through our workspaces who believe that they might be at risk of having coronavirus. So it's been very real for us for a few weeks, and like everyone else, we've made really big adjustments to the way that we work. What else? I mean, I guess I've had a couple of people contact me with medical questions. I guess for most healthcare workers, we're all really busy at the moment, and even if it's something like my clinic changing over to telehealth, that's in addition to our usual work. So for example, in my usual work, I'd work in 2 or 3 hours overtime a day just to get things done, and so then you've got to find some time to put in, you know, extra hours to work out how to convert your practice to, you know, whether it's what cleaning we do in between patients, or how we use telehealth, or keeping up with the changes the government's announcing to availability of telehealth items and all that kind of thing. So I think everyone's just really tired in the healthcare sector. I'm sure I've got something more uplifting to say than that. It was really meaningful to me actually to go this week on Tuesday to when Coles announced their actually Thursday, I think I went after Coles announced their healthcare worker hour between 7 and 8 a.m. And I won't be using that again because I won't be seeing patients face to face, so I don't think it's really the right thing to do. But just to be able to go there and have a sense that that healthcare workers were being held in regard and thought of in terms of how we could actually manage to get the supplies that we need for our day-to-day life. So that was really that was quite meaningful to me, and I was surprised that to feel that so personally affected by something that a large corporation had done actually. Some of the Nicola, you mentioned about just with providing supplies for people in terms of mutual aid. I guess just that awareness of safety and trying to keep things as sterile as possible. So I would suggest that it probably depends to some extent how high the levels of infection are in your community, but it's really difficult to know because there's a sort of 2-week lag generally before it becomes apparent, and we know that most likely it's the most serious cases that are apparent within that 2-week period. So just to be aware that to be really cautious about anything that you physically provide and the safety of that, and not just how safe you've been with those items, but how safe the person that is receiving those items feels. So things like baking, this is perhaps a bit over the top, but my practice at the moment is when I buy something that, from a little baker or something, I take it home and I rebake it to be sure about the safety. And so I guess I'd just say, if you're making a cake, it might be better to leave it uniced, for example, or some biscuits that are going to be fine if they get popped in the oven for another 5 minutes, or a quiche that can get rebaked, that kind of thing. So food that can be reheated so the safety is assured.
And so can I just clarify so I understand that correctly, something that, so heat in this instance, just a short amount of like a short blast of heat should kill the virus? I
don't have any number
in the food scenario.
No, but I can try and look at that while we're online actually. But I've been kind of just essentially I think the World Health Organization recommendations are that normal food handling procedures or normal that essentially normal food preparation, obviously it doesn't entirely make sense, but normal food preparation should be adequate. So I have just been working on the understanding that baking something or boiling something for a short period of time would, like most other things, kill any live pathogens. I guess that what's different, for example, compared to a bacterial illness, is that bacterial food poisonings often there might be bacteria that create a toxin, and that toxin can remain in food even if it's heated. So obviously you can't kind of just leave a stew sitting out on a bench for a week and then reheat it and it's fine, because there'll probably be toxins in there already. But we're talking about killing something which is a virus particle rather than something which produces toxins. The particle itself has to be intact.
The one thing, just to give an example of what I've thought of doing, so that I'm doing support for a woman who has a child with Down syndrome, and she's struggling in the hugest way. She's in a tiny flat with an adult daughter who's 20, who has Down syndrome, and honestly, she just what she needs is some people to talk to. So I'm doing her washing, and that's an excuse to to drop it back to her and have a yarn and stuff like that. But so she's been very, very careful. So what I've sort of done with food and things like that, and I just wanted to kind of check this with you to see what you think about the process, is basically, lots of hand washing before, during, after, resisting the urge to stick my finger in the cake, even though it will be baked. I just think that's probably good practice to just not do that. Lick the spoon afterwards, obviously. But so like mask, gloves, in the handling, not physically kind of like breathing all over everything, and not physically putting my hands on stuff, and then trying to kind of like put it into a bag. I bought cling wrap for the first time in about 20 years, but to not put it into sort of like a container that I'd then be handling, sort of rehandling and stuff like that. So just trying to keep my hands off it as much as possible, and kind of like dropping it to her in a way that doesn't mean that it needs to be handled again. So does that sort of sound, roughly the right process?
Yeah, I think it's really hard, and everyone will have different thresholds because it's just about reducing risk. So you're trying to, if you have the virus, you're working on the assumption that you do have the virus. You're trying to, prevent it getting onto surfaces, and then have have a way that the person can remove that item without necessarily touching the surfaces that you've used. So I don't know, maybe for someone, for example, if you were, wrapping a cake up in glad wrap, maybe they could have their own container outside with a lid on, and you can tip it into that container, and then they can remove it in whatever way they see fit, essentially.
Yeah. And one other thing that I wanted to ask your comment on as well, one of the reasons that I'm pretty sure she wasn't able to join the course, you might want to tell her own story, but so flag if you're here, obviously I'm not going to mention her name. So one of her kind of breaking points, I guess, was that in the UK, they actually announced in terms of what they would do in a triage process is that people with Down syndrome would not be prioritised in the case of sharing ventilators, and that's a profoundly confronting thing for a parent to hear. And it sounds like there was some significant backlash, and that has changed. I'm interested in your take, Merryn, on if any of us are supporting health workers. It just sounds like the point of triaging that we're hearing about in Italy is wildly confronting. And yeah, I just wondered if you've got any comments on that.
Well, I guess at that point, it's going to be done by people who are so subspecialised that there's going to be a really big gap between any of us here, including myself, and unless us in the hospital or our loved ones, and the people making those decisions. So, I sort of, I don't know. I guess that's a policy-based, there's a policy framework that will presumably be developed, and really I think it's having some input at that level that's relevant, rather than trying to in some way engage with the frontline workers in that regard, if that makes sense.
Yeah. I think this may be something that we all just need to have an awareness of, really, and it sounds like a lot of people are having difficult, at both ends of the scale, difficult conversations on the physical distancing, both with like very grumpy elderly parents who just want to do what they want, and also with younger teens in terms of that spread factor. And for me, that was certainly one of the things that sort of hit home, I guess, from my perspective. I've got a hand up. I actually reckon Merryn will probably have quite a bunch of questions once we open it up, so I might hold that question, Serena, if that's all right. Mez, did you want to add anything else at this point, or are you just happy to stick around for questions?
Yeah, I'm mainly just happy to be here for questions. Oh, actually, one other thing I was going to say, sorry, I mentioned earlier that people sort of contacting and wanting just some perspective on medical advice about what services to use or to access and to not access at the moment. So, yeah, and it's probably not obvious from the outside that at the moment we're quite early on, particularly if you're in a more regional area, in terms of the number of cases of the virus. So I kind of would encourage people that if they've got any unmet healthcare needs that they would imagine might become something more acute within the next 6 months, this is actually a good time to make sure that they're addressed. So things like, you've been recommended to get a CT scan, but you've never got it done, or you've got some need that's coming up. If you think that it might be needed to be dealt with within the next 6 months, then I'd suggest try to get that looked at straight away, rather than waiting 3 months down the track when things will be a lot harder. Also, just really encourage people that their GPs will now be able to take calls from them under their Medicare billing, which they haven't been able to do in the past. So in the past, it's been really hard to get your GP to give you test results over the phone or advice over the phone. But that will change now, because they are able to bill Medicare for that. So if you have any questions, your local GP, your usual GP, is the person who will be able to answer those. And even if it's, is our local hospital overwhelmed, or can I go there and get my X-ray done? Is it safe to go to the local hospital, or might I catch coronavirus? Your GP is the person who can answer your questions. So just really encourage people to try and use that service as much as they can, and to call and ask for a phone appointment rather than walking face to face, because that will make everyone safer and feel better.
Yeah, my doctor was great. I saw them recently, and they had very clear setup and offered phones the next time I needed it and things like that. I just want to put a caveat on what you said though. So for example, one thing with myself is I thought, oh God, I should get this dentist thing, I've got like a niggle, I should get it sorted because it's going to get harder and harder. They can't do any dental work at the moment because of the aerosol and the risk. And like pretty.
Did the dentist say that?
Yes, like actually had an appointment this week. They've been kind of banned from doing a lot of procedures. I think some urgent stuff they're still managing under some kind of conditions. I don't know enough to comment on it, but just to kind of give people that warning, and that also a lot of elective surgery obviously has been cancelled. So like some of those things that you might want to get checked out, there might just, I guess there may be challenges with that as well.
Yeah, I mean, you can still ask the question, I suppose, but some things won't be proceeding at the moment, for sure. And I have heard, I think it's with dentists, it's really probably practice to practice, as it is with medical practitioners as well. But most dentists that I've heard, well, what I've heard is that dentists are happy to see people who are in acute pain and to provide that treatment that's urgent. But they'll all have different levels of supplies that they have available, and different decision making, and things like the age of the dentist and whether they have any pre-existing that will be relevant.
This was very new advice, so that this was like, as in they had gotten guidelines on Tuesday that said that like that, obviously they'll try to deal with acute pain, but like initially they told me that they could do a filling, but then they said that they can't as of like a day earlier. They've got new guidelines. So just get it. If you're in that situation, just get onto it soon and see where you're at, and make sure that you're not dealing with it harder down the line. So thanks for that.
The only one thing I might say about the question of ICU and ventilators and availability is that I'm not sure that I have. There may be other people who have a better insight into it than me, but having talked to some of my colleagues who work at the local hospital, hospitals are doing a huge amount of planning and preparation for how that they can upscale their availability. And I think that there are really good plans in place. So it depends on obviously the amount of demand and the number of people who need treatment, but I guess I'd be reassured that it's been taken incredibly seriously, and there are really great plans being put in place to provide as much ventilatory support as possible in Australia.
Yeah, and I had a post.
That's what I'm very happy to answer any questions to the best of my ability.
Great. We've got a couple more speakers, and then I really want to open it up for kind of quite a wide-ranging discussion. So thank you for that, Merryn. My personal experience of being tested for corona, I was quite sick a couple of weeks ago. I've written up, and I'll share that with people as well, because it funnily enough was actually a very reassuring process to go through, even though it was time consuming, in that I really got to see how seriously they're taking it and how well they're doing their jobs, and was incredibly grateful really for the service and the that we actually have got a healthcare system that doesn't look like America. Absolutely tragic what's happening over there. Okay, going to go to Jessica, long-term friend, fellow counteractor, and someone who I moved in with something like 10 years ago, and moved into a hospitality house. Like Jess just does mutual aid as life, really, and is one of the best people I know in terms of just like checking in with the neighbours, sharing resources, doing all of the stuff that, you know, we all want to do and maybe aren't as good at sometimes. She's very good at it, and I think it sort of comes as a way of living, actually, for Jess. It's just like that living kindness. But yeah, really want Jess to expand on the different initiatives that you've done locally, the little bits and pieces like the thing on the fence and other mutual aid work, and your thoughts on where we're at.
Cool. And also for CounterAct's purposes, it would be great to have a screenshot for our own internal things. So if for the next 30 seconds you want to all look really interested, regardless of what you think about what I'm going to say, and then Nick can take a screenshot. Wonderful, thanks. Merryn, if you're happy to be on screen, I know you're on the same screen as... Anyway, if anybody wants to go, picture for 30 seconds and look really interested or really encouraged by what other people are saying, that would be amazing.
Maybe we might do you want to do maybe we'll do one cult photo and then one non-cult photo. I always find this a little bit culty. So hang on a sec, I'll just get to the screen with the most. Whoop, where are we?
So while I'm playing with my hands.
So I'm going to just, hang on, ask everyone to, let's wave. Hi, everybody. Hang on, I can't see.
Oh, yeah, really
waving.
It looks very crazy.
Like this, you think?
Yeah.
Hang on a sec. I was going to do that, but I was going to do it later. So this is a good idea. Okay.
So I just thought I'd do it as a participatory moment in the middle.
Thank you.
Before people move up.
Excellent. You're gorgeous. Oh, hang on. I should do a non-crazy.
Yeah.
People
so I'll just start
nice.
Talking and Nick can take some screenshots.
Look intrigued by Jess. This is basically what she was setting herself
very
up.
Interesting.
That's all she wants.
Very interesting. So I don't know, for me, about 2 weeks ago, I saw another news article about stuff going off the supermarket shelves. And I went, screw this, like I just need to do something about it. And I don't know about for you, but for me, I've really noticed that in the last 2 weeks, when I'm doing something for others or engaging with others or thinking about others, my own anxiety level drops. And I'm finding I'm spending a lot of time on screens or on telephones, and actually I'm finding it really stressful. So for me, doing these things that I'm about to talk about has been really good for my mental health and my sense of kind of being in the real world and not just in the virtual world. So 2 weeks ago, I saw another one of these stories of the toilet papers coming off the shelves. And like probably many of you, I subscribe to Who Gives a Crap. And my biggest toilet paper problem is what I do with all the toilet paper once every 6 months when it arrives and where on earth that goes. So I had seen a couple of news articles where people had done a plastic tub and put it out the front of their house. And so I said, screw it, I'm going to do it. And so I put a plastic tub out at the front of my house and put some toilet paper and some groceries in it and put a little note on. And there's been two things that have been phenomenal about that. The first thing is watching who gives and what they give. So at the moment, there's a cup of flour in a Ziploc bag. And I'm guessing that's what somebody could afford. But I live in West Heidelberg in Melbourne, which isn't known as, you know, a high income area at all. And the first two people that put in lots of stuff in the bucket, both are in public housing, both who are on low incomes. So what I noticed is that I was really nervous that it was going to be, you know, middle class do-gooder thing. But actually what having this bucket out the front of my house did was provide an opportunity for all sorts of people to be able to contribute what they do. So there's somebody that I know who gets lots of food parcels, and in food parcels you get food you don't really want. So they got to bring a whole lot of tin fruit that they don't eat and put it in the basket, and then it went. So it's been this amazing thing out the front of my house to see food come and go, and just a real sense of mutual aid. And the second thing that's been amazing about that is watching how much it's been shared on social media, or how much people have said that it makes a real difference to them. So
Hey, Jess. Sorry, mate. Just you're getting a little. You're coming in and out a little bit. So if you can try to, I know I've been on that same computer with you. Just talking in a bit closer because you get animated.
All right. I'm going to start talking into the bottom of my computer. I'm sure the people who manufactured this computer thought it was great having a very directional microphone, but it's often a pain. So the second thing I've noticed is people just being so inspired to see it. Because what's happening is that the media are reporting about empty shelves, and that's the narrative that's getting told and retold and retold. People are starting to freak out about what sort of society we're living in, whereas actually there's a whole lot of generosity going on. It's just not on the Channel 9 news. So what a whole lot of people have said to me is it's just been really helpful in terms of reminding them that there's good people around. So I think, you know, a bit like Cara was talking about, she's putting out notice in the mailboxes. People might not need anything from her, just like they might not need any toilet paper from my box. But what it does is helps that communication of we're all in the, you know, there are people who are thinking collectively and thinking about other people. So it's been a wonderful, my little, you know, it's like a little box of groceries. It's been really good practically in terms of people being able to do things for one another. And I've noticed that often it's people who don't have a lot that's been sharing, and also the symbolism about this thing being powerful. The other thing I've set up is a street library. We've kind of had it in the wings for quite a while. I don't know about you, but I forgot to stock up on books before everything shut down. So I'm actually feeling in need of a book library myself. So I've just set up, you know, a relatively waterproof space out the front of my house. And again, noticing that people are leaving and taking books already. And, you know, I mean, I'm wiping it down with metho a couple of times a day and washing my hands every time I touch it. And so I guess, and I'd be interested in Merryn's take, but I guess I see that in any exchange of things, there's a risk. But my own take at this point is that we've got to make sure that there's some sense of exchange. The other thing I've been really mindful about is that I love interaction with people, and I can get a lot of it online, but lots of my neighbours can't. And I've got a little garden out the front of my house, and I mean I've got quite a wide nature strip, so there's physical distancing while being out the front. But I was just planting some seeds in my garden out the front, and a neighbour came by and she was like, "Oh my goodness, it's so good to see somebody." And she hates Facebook and she hates online stuff, and so just being out in my front garden meant that I had a few conversations with neighbours. You know, we were all ultra careful. It was like at 5 meters distance. But that sort of stuff felt really, you know, just to be physically present outside my front door seemed to be important. Yeah, and I guess the other thing is I know lots of neighbours to wave to, but I don't have their phone numbers. So, and there's a woman who lives on the corner of my street who I've seen to wave to and do facial gestures with for a long time, and she is unable to hear. So, but I realised I didn't have her phone number. So I hand sanitised my hand and wrote her a note, and hand sanitised my hands again, and just delivered a note in her mailbox, kind of saying, "I know we've talked to each other, but I live at this address, and this is my phone number, and let me know if you need anything." So I guess another one of those ideas to think for those who aren't already connected online, just thinking about those folks. Yeah, I think that's kind of probably enough for me at this point. I might call check.
Okay, thanks, Jess. Okay, so we are halfway through, And they are the few people that we had lined up definitely to talk, but then I've actually got a few others that I wanted to call in as well. Maybe we could mix up the age demographic a bit, and while we're thinking about how do we communicate with people in different ways, people who might not be on Facebook. Bella, do you want to share some thoughts with us about how we can, I mean, I know that like some of us adults have kind of bullied you guys into using Facebook and you're good at it, but I know it's not the default hangout space for people in their teens and early 20s. So what is your thought on, yeah, sort of like young, I mean, also you're in a regional area. Yeah, what are your thoughts?
We don't really use Facebook as much. We've moved more to like Instagram and Twitter and those kind of platforms now. But, you know, even like I know a lot of my friends have just been putting out like messages on their Instagram, things like that, you know, like, hi guys, how's everyone going? You know, I'm isolating because I don't want to get sick and I don't want to make other people sick and all this kind of stuff. So it's really good. Like even the younger generation understands what's going on, and we're trying to support ourselves and the other people around us in the same way, but just using different platforms as you guys are.
Mm-hmm.
But definitely, and I think the idea of sometimes even like putting a letter in a mailbox, like you don't think that'd get to the kids in the house, but generally the parents will do it, and then, you know, they'll tell the kids about the letter. And the kids will then, they might even join themselves, or they might tell their friends about it, and then the teens might create a group just for their friends or something like that, you know what I mean? So one act like that might start a different kind of act for our generation and our social media platforms and things like that. And so
say for your street, for example, mate, like are you in contact with your neighbours? Are there other people your age on your street that you kind of have peer-to-peer contact with? What does that look like for you?
I was lucky when I was at school that like 4 people that went to my school live on my street still.
Great.
So we're still in contact through different platforms and things like that. So it's good because we're about to send out a letter to our street. So I'm hoping that we'll be able to get like a youth chat group up, because I know that there's lots of kids on my street that are around my age, maybe a bit younger, maybe a bit older, but still.
Great. So what do you think, like in terms of what we can recommend for older people on this call, is it sort of useful for us to maybe put an option or some kind of connect point, or, and I mean, one of the things that I actually was going to do for this call, which I didn't at the beginning, my bad, was actually say if anyone wanted to tweet about this, that I thought that we could actually try to use the hashtag Adopt Your Street. It's also Neighbours Day tomorrow, but I think that the thing that we really want to push home is the hyper-local approach, because when we do go into the full lockdown, that is when you're going to be able to cross the road to see an older person, to check in that they're okay, but you're not going to be able to necessarily drive your car across the suburbs to go to someone else's house. So these suburb groups are awesome, but I do think, like in my ideal world, it's a little bit of a spider network that we're sort of going in concentric circles out of, like, this is your street is connected to your suburb kind of hooks in and shares resources with the larger platforms, and some of the bigger kind of Melbourne Northside group I think is in particular really impressive because they put a lot of thought into the group processes and stuff like that. So I'd really recommend people check that one out. But I think also maybe in this sort of like spider web of connection, we need to have sort of like strands that are connecting peer to peer. So looking like, I don't know, what would that look like, Bella? Would it look like an Insta, just like young kids connecting on Insta, or putting your Insta handle on the thing that you drop off? Like what do you think would work in practicality with young people?
Probably like adding your handle on, like if you're sending a letter out or something like that, adding your Instagram handle, Twitter, Facebook sometimes helps, all these kind of like platforms, making sure that they can reach out in any way that they would like to. I know that especially, well, I know a lot of my friends and young people, especially in like rural and regional areas, we haven't really been affected as much just yet. So I know a lot of my friends don't take it very seriously or whatever, but sometimes like you can feel their anxiety around it sometimes as well when they go around and see their grandparents or whatever, and they come back and they're like, wow, you know, like this could affect them and it could affect me as well. So sometimes even just having like, I don't know, if you have like, I don't know if they reach out or something like that, making sure that you check in with them, and the family especially, because, you know, I know a lot of families, 6 layers of separation or something like that. So there's always going to be somebody who's affected. So making sure that if you're reaching out, making sure, you know, asking the questions, you know, have you had anyone affected? And if so, what can we do to help, and how are you doing? Because it might not be the child, but the kid, I know I can sense when my parents are worried and things like that, and that makes me worried. So sometimes reaching out to the family and not so much just the kid, to see how the whole family's doing.
Yeah, great. That's really important. And one of the things that Alex mentioned earlier in a different kind of strand of conversation is just the and seeing how many parents are affected, particularly with younger children, who can't do their jobs properly at home while they're looking after children, and this expectation societal wide that we're going to just be able to kind of operate normally with everyone working from home, when that is deeply challenging, and you know is not actually 2.5 million Australians don't have internet, so we're really wiping out and not actively looking after big sections of the population. And it's very unfair, I think, for workers. And I'm not a parent, so it's not up to me to drive this conversation, but seeing Alex kind of put this out on a thread, and it's like, you know, 20, 30 other parents going, it's driving me crazy. I'm finding it so hard to work from home. This is really difficult. You know, for example, I would love to see the unions kind of pushing for, like, if you are required to work at home and you are caring for your child, we expect just 50% capacity from you, or something like that, you know, like, so something that society-wide, that we are not piling on guilt on top of, you know, everything else in this really, really full-on situation, when the most important thing for parents to be doing is to making their children feel safe, and, you know, like holding space for the family together in, you know, what could be getting a very fractious household in, you know,
yeah, because it's adding that extra layer of stress that's not needed, especially in times like this, where you might have somebody affected or something like that.
So we are going to go into some logistics stuff as well. So can you stay for the full call, Bella?
I think so, yeah.
Great. Okay, because I definitely kind of want your input into that. So how we, you know, because you're just representing a few million young people here. No big pressure to speak up for that demographic. You seem to be able to manage it pretty well. So there's a couple other folks I wanted to draw on. We've got Jodi, who's got like a particular project, which I think is a rad mutual aid project. We've got Mim from Get Up. One actual thing that I would like to go to first, though, is hearing from one of the people in the Canberra group who seem to actually, you guys seem to have like a relatively good system, and you also seem to be doing some really good cross coordination, as in people seem to know what area of Canberra they're in. That sounded really silly, didn't it? But, you know, like what area they can connect to, and that it's, you know, it's roughly covered by region. That seems to be happening in Brisbane as well, with, you know, there's Brisbane West Side, North Side, etc. Melbourne, less so in Perth that I've seen. There's different things, different places. So anyone from Canberra want to pipe up and just let us know, how is your mutual aid group working? What logistics are working well? What are you finding challenging? Just going to scroll through the screens to make sure I can see.
Meg here.
Go for it, Meg.
Okay, I'm in Dixon, which is in the inner north, and I got a letterbox drop a week ago saying that there was a new group starting up in 2 suburbs, Dixon and Downer, Corona Mutual Support Group. So I've joined it but haven't been particularly active. However, I'm also in a particular street that has been well connected for a long time with street parties. We've got a street library. There are about 60 houses in the street, and we would know someone in at least half of them. So we've started from a really strong base. But I guess that's not my main community. A Chorus of Women is a group that's been around for a long time, involved in a lot of, I suppose, being a citizen's voice around a lot of justice issues, peace, refugees, climate change. I know Janet is also part of, is online, and she, in her street, they've been coming out once a week, having drinks together from their own houses and that sort of thing. So, yeah, and we've been looking at initiatives for women taking active role in issues, trying to get away from an adversarial sort of framework. I don't know if, Janet, you want to say add anything about that, but I think, I mean, Canberra's, as a wider community, I think is fairly socially engaged in general, is what I would say. Janet, do you want to add anything?
Not a lot. I mean, in terms of what Nicola was saying before about Canberra being particularly well organised, I haven't really come across that. I mean, the activities that Meg's just talked about, things that we may be doing within our own streets. I'm doing something in my street, but also just through our existing groups like A Chorus of Women and so on. Just things that we're doing. I haven't come across an actual system or what you were alluding to just now. So I don't know if there's anybody else that knows more about that. Yeah.
I think I got that impression from looking at Meg Clark talked on another webinar I was on last week, and then I was looking at one of the it was a piece of writing that someone had done from that group, and then looking at the I mean, Mim also could speak to this because she's sort of been tracking some of the groups and would have a sense of what's organised and what's, you know, where some of the good structure is happening. It just appeared that it might have just been her group sounded particularly functional, but it sounded like that there was sort of groups by area and that they were doing, excuse me, some cross collaboration quite well. So, yeah.
I think from what's happening, I think our Chorus of Women network is particularly strong, and I put out an email this morning and 2 or 3 of us have joined in. But I think it's not really a geographic network, it's more a group of concerned citizens, I guess.
Okay.
Yeah. And we're doing a lot of stuff. If people want to have a look, it's achorusofwomen.org. You can see what we're up to.
Great. You want to pop that in the chat? Would be great.
Do that.
Yeah. And now Sarah had a hand up.
Hi. Sorry, got some cockies behind me. So I agree with the comments about Canberra. I noticed there's a Canberra Corona mutual aid group that did seem to be very well centrally organised. And just having watched lots of different things happening across the suburbs, that also seems to be working pretty well. All suburbs have been listed. There seems to be a general Google spreadsheet. And I got onto our local area group, which amazingly is just about all very young people. And that seems to be, there seems to be good autonomy. But I agree. I think it looks like there is some good central organising. There's also in Canberra, through the government, there's on the north, there's a group called Northside Services, and they're really keen to be a conduit between the mutual aid groups and government services as well to give extra help. And the government does seem to be a bit more actively engaged. And there's also been lots of enthusiasm from all sides of politics and business to help out too, in our experience.
Yes, one of the things I've seen is that some electorate officers and some pollies are really taking a strong lead. It seems to be very random. It's just whether or not, honestly, they're good local politicians. I think seems to be, you know, how involved that they are in it. But so the member for Perth here, I saw that they were doing calling parties with people on their database. checking in with older people. One thing that I've seen that I think is not working is the city of Fremantle, which is the adjacent actual suburban area to me. They have these flyers that you can letterbox, but then the idea is that you post them back to them, and it's not actually setting up any kind of peer-to-peer situation. And I think that is where, like with all politics, with all social change, grassroots will always be ahead. So people are always actually going to be leading on whether it is a political issue, a practical response to the bushfires, like so many initiatives that we saw. People in communities will always organise quicker and faster. And so one of the key questions that some of the organisers, and perhaps Nim will speak to, is like, how do some of the orgs with resources allow that cross-pollination work to happen? Because we will, like, this work is only going to be most effective, I think, if it is hyper-local and we are able to. So for me, what I would like to see out of this call is every person to say, I'm going to adopt my street. I'm going to either knock on doors and stand back at a safe distance and leave a flyer or letterbox. And I think for me, the middle piece is then how do we link those very hyper-local networks up with some of the other kind of umbrella suburb groups, and then how does, you know, an organisation with infrastructure like GetUp kind of like help in that process? Yeah, Nim, do you want to speak to that now and your thoughts and tell us about the platform?
I just noticed Fiona's got her hand up too, Nick.
Oh, sorry, actually, I had two questions. No, we got Sarah. Fee, go for it.
Hey, sorry, cooking noise in the background. I just thought it useful to mention what Newey's doing at the minute, where there's like a bunch of mutual aid Facebook groups that have popped up, probably about 3. I think they're probably going to consolidate at some point. And there's the, you know, the idea, I think, is that there will be lots of groups like viral kindness groups that have popped up out of that and then coordinate through just a Facebook group. And that sort of happened already. Like, I'm about to set one up on my street and there's another one in the next suburb over. And I think that yeah, that's just the situation here.
So are you saying that there's like people being quite open-hearted in communicating and like they've just got the same idea at the same time, so everyone's coordinating?
Yeah, definitely. And there's sort of an umbrella Facebook group, and splinter groups are starting to come off that at the moment.
Yeah. So one thing to just put in people's heads who are sort of organising at that level, I'm really hoping you all commit to knocking on your street as well. But for people who are working at that level, there are a couple of, there is another layer of conversation that's happening at an NGO level of how to support this tech-wise and how and what platform is going to work well in terms of connecting up mutual aid networks. One of the other things that was brought to my attention, and I see that it's something that I do want us to touch in on, is safety and the vulnerability of older people, and how do we as a community, you know, keep each other safe as possible, not have people overly exposed, etc. So that kind of stuff, I think, is a big challenge. That the perception in government is, from what I was passed on, that you know, whilst some of these initiatives are great, of course they want control over everything, but that they think that they can be quite problematic as well. So we need to work out in a true, you know, DIY, mutual aid, anarchic kind of fashion, how we create accountability in the group, how we kind of look after each other in these groups while we're organising peer-to-peer in this kind of way. Yeah. Mim, do you want to take the floor for 5?
Sure. Thanks so much for inviting me along. And I just, wanted to say to everybody, like, the work that mutual aid folks are doing in this moment just couldn't be more crucial. Like, just kind of taking it a level up, big picture politics for a second, like times of crisis like this can really bring out the best and worst in people and in governments. And I was pretty freaked out to see a news article the other day talking about how the extreme right were like all communicating with each other on Telegram about their plans to take advantage of people's fear and panic in this moment. So, yeah, to sow fear and division in the hope that they can actually bring about the collapse of society. And, you know, like, I really have on my mind the fact that like the economic impacts of this could be depression level. And the depression led to the New Deal in the US and fascism in Europe. And like literally like people doing this kind of work is the glue that holds the kind of social fabric together in times like this. I think, yeah, I just think, you know, when we're like kind of showing up.
Might have lost Mim. Other people
I
hearing
think
you?
I'm back, sorry.
Okay, gotcha. Yep.
Yeah, sorry. What was I? Oh yeah, when we're kind of showing it up for each other, it makes it a lot easier to get governments to show up for us as well, including, you know, making sure the recovery looks more like a Green New Deal than, you know, shock doctrine style antics. So yeah, just on the practical stuff.
Quickly explain shock doctrine if you can, Mim, for folks that haven't.
Yeah, so like, you know, large corporations or autocratic governments are taking advantage of moments of crisis to shove through their pre-existing agendas. So sometimes it gets called disaster capitalism. So, you know, examples, there's a lot of examples, but, you know, like taking advantage of it to do privatizations, taking advantage of moments like this to give tax cuts to massive corporations, or, you know, slash and burn social services. Like, I think so far we're not seeing that, but, you know, that's one of the things that it takes, like strong civil society to counter when attempts like that do go through. And we are seeing some of it with the mining lobby, I think, mobilising really fast to be declared an essential service, get all kinds of exemptions. You know, saw it in Victoria with Dan Andrews, like taking advantage of, I think, the corona crisis to shove through the overturning of the onshore gas ban, for example. So yeah, it's definitely something that we need to watch out for, and strong civil society is how we do that. Where was I? Oh yeah, the Viral Kindness site. So I can't take any credit for this at all. Some great comrades from the tech team at GetUp and also the human rights team ran straight away out to make this site happen, just as a way, sorry, I should probably post it. So it's just viralkindness.org.au. But it's basically just a hub to make it easier for people to see whether there's already a group in their neighbourhood, in which case just sends them directly to join that. And I think when we sent our email, about 2,900 people from our list went and joined groups that already existed, and for people to add their group so that other people can find their group. If they're interested. We're adding a map function to it at the moment, so I think it'll also make it a lot easier for people to visually see where the gaps are. And I think that'll be easier for us as well to then be able to reach out to our members in those areas specifically and encourage them to kick off groups in those areas. The site also has a little like download a postcard tool, and we just created like an updated version of that, which makes it easy to just put in your contact details and like the website of your group, so that it's we're encouraging people to go to groups, not just to individuals, which I think is important. So
yeah,
you know, still encouraging people to put their phone numbers in. So for folks who don't have the access to the internet, there's someone to call. But for those who do, actually making a bit more of a many-to-many contact point than some of the postcard templates have had. And we thought that if we made it easy for people to put their contact details in, then that cuts down on the handwriting, which makes it easier because you don't then have to wait 24 hours before you can go and distribute them. You can just print it straight off, or use that as a poster as well, as a poster template to put up around the neighbourhood.
I'm just going to throw this in while I remember. One of the little tools for making life easy is Bitly. I'll pop the details in it, but one of the barriers being, you know, like really long Facebook group names and stuff like that. So I was able to make a very long URL for the Eventbrite into a shortcut, which was just bit.ly/mutual aid forever. And it's something that people can remember. And so we've done that for our flat here, like our group of apartments. So it's just bit.ly, you know, our address. So yeah, just a little,
makes sense.
Yeah.
Yeah, I think we'd actually talked about including that in the webinar that we're doing Monday night. Also, we're also doing a webinar on Monday night, which is for folks who have already been running mutual aid groups to share some of their hot tips, kind of like tonight actually, but we've invited our whole list to that. So we're going to be encouraging more people. And we had the same idea that Nicola had, that actually it kind of looks like a lot of these groups, like completely fantastic, but also so big that it sort of makes it hard to do group formation and like the team bonding that you get with smaller groups. So we're going to be really strongly encouraging our members to set up those kind of hyper local, you know, adopt your street or adopt your apartment type groups. Another just little thing that we've just done is a survey for people involved, like actively organising and coordinating these groups, to try and get a sense of, you know, what all of these groups are, yeah, what kind of things people would prefer in terms of like the sort of tech support that NGOs like mine could potentially provide. And sorry, thank you. Who was that? Was that Leanne? Yes, Leanne. Sorry, I totally forgot to introduce myself. My name's Mim, and I've been working at GetUp for the last 4 years, currently as organising director there, but I've done a lot of the climate campaign work at GetUp. And yeah. And I'll just post all of those links. I think that's the main thing really, Nicola. Like, we're keen to get a sense of what's working. Oh, you've registered, but you haven't received it, Serena. Okay, that's unfortunate. All right. I'll check that. But I'll post the link here as well.
Okay, you're dropping out a little bit as well. So what we'll, I'll make sure that everyone gets a follow-up. And so I'm just looking at this. Yes. That's a really good point, Josh. I was hoping that we would get to talk about some big picture stuff towards the end. So we might skip quickly through a couple of other people just to share their projects and take home. So I know that Serena, you're doing some local work. Yeah, do you want to just give us a couple of minutes on your what you found working, what's not working for your group in the Blue Mountains?
Yeah, hi everybody. It's been really interesting. So in the Blue Mountains, we're a community that's been left pretty traumatised by the bushfires. And out of that, I actually really wanted to set something hyper-local up anyway. And then this happened. So when I took the plunge, we have a Facebook village-wide, suburb-wide group, but I knew I needed to keep it small. So we do have a pocket of streets. There's about 6 streets and about 300 homes that's like geographically defined. So I asked in the Facebook group if anyone would like to help set it up. And so because I really wanted a few people to bounce ideas off and to actually help do some of the work, because I wasn't going to letterbox 300 homes, but I really wanted it to be our pocket of Falconbridge. And I got about a dozen people within a few hours putting their hands up to get involved. And some of the things that really worked was certainly, I mean, the timing. People were so ready and keen for something like this to happen. And once we did it for our pocket, I noticed some other people started saying they were going to do it for their streets, and it was triggering it elsewhere. But I did a quick, one day on the day after we started, I did a quick Zoom meeting with whoever was available, and I got 2 people really quite capable. One retired fellow who, all his men's shed activities had been cancelled, and he was really valuable in providing his insight, and a woman who's self-isolating but also really capable at community building. And that was just enough to help plan what the leaflet would look like and a few things. And we did have questions about privacy and how, because we want to also make sure the vulnerable people will be looked after. And we've talked about how do we know who they are, but how do we also protect their privacy? I've bounced ideas off a friend who works for the neighbourhood group. And I think in time, their process of actually doing police checks might help us with that. But for the time being, we're relying on people's goodwill. Look, we're a pretty mixed area, reasonably mixed area politically. You know, fairly middle class, but we've got Stop Adani, you know, posters in some windows, and we've got Go Badgerys Creek Airport stickers on the tradies' utes. But look, other barriers were probably having people, we'd have people keen to letterbox, and then we'd have, but not necessarily give out their phone number. And then we have people keen to help, but they're self-isolating. So it was just, I put a poll up to see who was available to moderate the group, because we created a Facebook group, who could monitor a generic email. So we've set a generic email address up, who could letterbox, and including providing a phone number and a name. And then there'll be other people who are prepared to step up and do different things, but maybe not give everybody their phone number. So everyone's sort of got a mix of what they can do and what they're prepared to do. And we're still finding our way through that. Miriam, we took the Get Up, the Viral Kindness postcard, and I had to add more things to it. We adapted it. So it was focused at people who might be vulnerable and needed some support, but it also promoted the group, and anybody who was interested in joining could come along to the Facebook group. But yeah, we've got the email as well. And I acknowledge not everybody's on Facebook, but we've got about just over 50% of houses in our pocket have been letterboxed. We got 56 members after 8 days, and we've had these kinds of messages. Hi, I've lived on St George's Crescent for about 5.5 years. We've got 4 kids. Thanks so much for setting up a group like this. I was feeling so down, then I got your note, and it was such a bright spot in all this craziness. And an email from an older lady. Thank you for your leaflet. It's very kind of you. At the moment, I'm fine, but if I need any help, I'll take you up on your kind offer. And Terry, who's helped, he's the retired fellow, his men's shed, all his activities cancelled, and he helped with bouncing ideas off in the beginning. He said, I've received several text messages thanking us. I'm so very pleased with your initiative and the positive effect it's having in our community. So it's been really lovely, really positive. I know we haven't quite reached everybody yet, but it's starting to get the ball rolling. I've facilitated online groups and facilitated, you know, face-to-face groups for many years, so that helps. That has helped. But it really, there's a lot of reassuring I'm doing where I've got people who desperately want to help, but their personal situation means that they can't. Yeah. So there's a lot of, it's really fine, you know, there'll come a time, it's just really good to have you, you know, in the online group. Lots of musicians, and I think there'll probably be a music on the Verge afternoon soon, where all the musos and singers will come out and have a bit of a play and a sing, so people could walk around the neighbourhood and be physically distant but connected.
Awesome.
Yeah,
that sounds really great, Serena.
Yeah, it's going good.
Awesome, great. And I think it actually, for me, it just really helps to hear those stories and to hear some of that positive feedback. I didn't quite manage to pull it together, but I was hoping to organise an artist to serenade everyone at the end of this Zoom call. So maybe we'll do that next time, because I thought that if we're doing these kinds of events, and you know, so much of it's going to be online, and it's very hard to concentrate for long periods online, like maybe we can include an artist and they can spruik their, you know, their Patreon or their YouTube or their Spotify album or whatever, and actually have some music in the middle of these calls and things like that. So both online and offline, in terms of, you know, there's people that are having little, you know, Verge parties and, you know, having dinner every night. Like there's actually some streets that are having dinner every night, just like out the front. So they're actually physically seeing people. And I would echo what Jess said in that the doing practical stuff is what's helping my mental health right now. And I think for me, the bit that I'm scared about in lockdown, and I'm sure we're all really confronted by that, is like not just the physicality of it, but just, yeah, feeling alone, and just how do we do those really small little things you know, to reach out to the people around us. Yeah, so I've got lots of, I think that there's a lot of hope in this stuff. We've got 20 minutes to go. I do want to make sure that, well, two things. Want to let people know that there's the option to stay and have a bit of a yarn, and there's breakout rooms. So if you kind of want to troubleshoot with each other or plot and or have a happy hour and have a chat to other folk, if you've been feeling a bit isolated, we're really happy to host that. The other thing is that CounterAct can, you know, we can loan you our Zoom setup if you need to, you know, have longer than 40-minute chats, which is what the free account lets you do. So I'm saying that while I remember. There's a few things that have come up. I really want to make sure that we get to talk about them and just sort of open up for broader questions. But a quick minute from Jodi. Do you want to just talk about the project that you're working on?
Hey everyone. Yeah, so background, I was doing a lot of campaigning in Stop Adani, but then I've sort of moved over to Extinction Rebellion, and I'm very much aware that Extinction Rebellion is potentially losing a lot of support that they had a few months ago, and there's not necessarily the appreciation for the need to constantly reach out and grow that ground support base that's not necessarily focused on getting arrested.
Yeah.
And so that's the little backstory. But then I was speaking to a very good friend who I know from Perth, who's a GP, about 10 days ago. And she was just saying how terrified she is with what's coming down the line. She's a GP in Cairns, and her husband's also a doctor. And she's very, very calm and very, very sort of matter of fact. I've never heard her talk like that before. So that really rang huge alarm bells. And then I was just sort of asking her, you know, what her thoughts are on masks and stuff like that. And then later on in the week, she said, oh, you know how we were having that conversation about masks? Well, funny thing is, because I mean, a lot of doctors are very conflicted. Merryn, I'd love to hear your thoughts on this. There's so much information going on about the pros and cons of masks. And I'm seeing so many people in the community wearing surgical masks. And anyway, so Irene said, yeah, the clinic head GP put in an order with the local seamstress for fabric masks because they had no N95 masks, let alone P2 masks, let alone surgical masks. And they're going to be on the front line of this thing. And then a few days later, I spoke to another GP friend of mine who said their clinic had like, I think 10 N95 masks, and you're meant to use one mask per patient, and they've got a clinic of 6 GPs. So that's just not going to work. And then, so Irene ended up contacting me a few days ago and said, you know, that conversation we had, well, are you still thinking about making masks? Great, I'd love some. I'd love 10, please. And then her cousins, who's a nurse here, who, by the way, was told by her, the hospital she's working at, that they're not allowed to wear masks because it might make the patients afraid. She also put an order in for some masks. And when I say order in, they're free. I'm not charging for them. They just put, wanted some made. So, I mean, on one hand, I was reading a lot of stuff, including stuff that Irene shared with me about, there's there's some research that's gone around that says if you wear a fabric mask, that potentially could be worse than not wearing anything because of the amount of moisture that's retained in the mask. But then on the other hand, there's thoughts that go, this is where my headspace is, at least it stops people touching their face if their fingers are contaminated. It's more just a physical barrier. And if you are infected and you cough, it's not going to necessarily go beyond you. But yeah, so I was sort of thinking in terms of an outreach idea for Extinction Rebellion. And initially I was sort of thinking we could print the XR logo on it, but then I could just imagine all these nightmare scenarios in the media of, so I just sort of
parked that one. I still think that there is nice somehow. Anyway, so I created this little, just the tag that goes on them. The very last line is, these masks were created by members of Extinction Rebellion. Just tiny writing. But I've just explained both on the group, which I'll share. So I should have mentioned, I set up a Facebook group called the Million Mask Challenge in Australia. So it's basically based on America.
Jodi, sorry, just to let you know, you're breaking up a little bit, and we might leave the detail of this. Yeah, we've lost this for a sec. So we might, I'll make sure if Jodi doesn't come back on that we go through the detail. I don't particularly want us to use this last bit of time to have a debate on the merits of masks. I think that, you know, Mev can give us her sort of 30-second perspective. But I have seen many people doing this work, and there's a group in my local suburb, Henny Hill, that are making the masks. And I do like the fact that when I looked at the work that Jodi was doing, that it was like she's actually got very clear references from who and all of the different bits and pieces of information that allow people to make an informed choice if they're gonna make them and if they're gonna wear them, and you know, not assuming that they're substitutes for proper surgical PPE and stuff like that. So if it's all right. Or do you want to say one last thing, Jodi?
One last thing. I guess the trouble I'm having at the moment is, apart from my friends I know in the healthcare sector, is actually finding, if there are other doctors and nurses, I'd love to hear from Merryn about this, if they do need them and how to find them and reach out, because I'm suspecting they wouldn't want to publicly say anything on the Facebook group. So I've set up an email for that reason. It's on the group, but no one's contacted me. So I guess the avenues of, because there is interest in people making them, but then what to do with them.
Yeah. And there are other groups that are doing it as well. And I also saw a bunch of chat on Twitter about it. So I'm happy to help connect some of those points up. And we might just leave that piece aside if that's okay, because I do want people to be able to ask questions, and I will, yes, go to Mez. Thanks, Jodi. It's an awesome initiative, and I think this kind of community building work is a huge opportunity for XR and all groups. Merryn. Oh, unmute, baby.
Unmute. There we go. Sorry, I just wanted to say thanks, Jodi. And I think that kind of work is really meaningful to healthcare workers, that people are actually, you know, looking in and putting the time in to do some research and to see what might be helpful. I think that the settings will be very different across different settings, but particularly GPs are frontline and they don't necessarily have access to what they need. So something that is, you know, often something's better than nothing, but it will depend on the individual practice. There is there's a Doctors Discuss COVID Facebook group that I'm a member of that has got hundreds or thousands, I think, of doctor members who discuss COVID issues. And one of the amazing things has been some distilleries, gin distilleries, that are making hand sanitizer that's just available for medical professionals who are doing face-to-face work. So I'd be happy to share the details of what you're doing on that group if you could, or if Nicola can put us in touch.
Yeah, that's awesome. Thanks, Nez. So there's definitely a bunch of questions. Can I just get like a bit of a read of the room? Actually, I do need another wave because I had a really good shot and then I screen capped over the top of the really good shot. So I haven't done this for a while. As you can see, I'm a little bit rusty. Are people happy to quickly hop on and give me a wave? Because we will have people dropping off soon, even if we extend. Oh, my next door neighbour's calling me. Isn't that a nice thing? Okay, I've got one. Hang on, where am I? Okay, as many people as possible. I'm going to do one, and then I'm going to paste it, and I'm going to do another one really quickly.
Including you, Nick.
Yeah, I look like an idiot, so that's all right.
You need to wave your arm, wave your hand.
How do I do that while I do control print screen at the same time?
One hand each. I'll do it. You do it. Put your hand up.
Okay, you need to do both screens. Who feels like a dork right now? Give me a clap if you do. Whee! Thanks, Jess. Okay, so I just do want to let people know.
Page two.
Quick, okay.
Everybody else.
I don't know whose page.
Yeah, one more. 3, 2, 1. Thanks.
I know that there are tricks on this. I've just forgotten them. Like, I know you can make the screen bigger and all that, but too much in my head right now. It's almost like there's stuff happening in the world. So we are at 10:02. I'm really happy to go over for a little bit longer and kind of like keep things open for as you know, as long as people want to have a yarn. If folk would like to kind of formally make a cut-off point of, say, 1/4 that you know, if you want to extend for to ask some more questions, can I just get a bit of an indication of interest on that? Not very much. People are tired by the sounds of it. So maybe we'll just do a quick couple of questions and work out some time, basically reconnect again. Does that sound better? Second option? Okay, great. All right, so I'm sorry that we just had too many good people to hear from, really. So I think probably the bit that I'm seeing coming through strongly in the questions, the ones that I've noticed, is stuff around safety and letterboxing. Can I get a bit of an indication? Is that something that people would like to hear from Merryn about? Yeah. Okay. Merryn, you want to have a bit of a a bit of a comment on kind of good practice. I mean, we can also, I'm happy to check in with Ms and send some follow-up details, but maybe just some top tips.
I mean, I think it's just really hard. I mean, once again, it depends on how likely you are to be infected and how likely, how high the rates are therefore in your community that really affects then what your risk is. The virus can survive on paper and cardboard for prolonged periods of time. So if there's any risk that you're infected, then, you know, you could be spreading something on a surface. I don't really know, honestly, what to say about how to make that better, because I see those things that people post about things they've got in their mailbox, and you know, it's not without concern. I'm sure it's very low risk, but it would depend. If you're in New York, I would certainly not be encouraging people to do that. If you can have a think about ways that you can do stuff that's perhaps, I mean, I guess you need to make that initial contact by letterbox. As soon as you've got someone's mobile phone or email address, that's probably a better way of contacting as often as possible. But yeah, I'm sorry not to be able to be more reassuring about that. Does anyone have
everything's emerging so quickly. There is a good article that I saw on the conversation that I think was relatively credible about how long things are lasting on surfaces. So I would definitely put that in the follow-up. So Mim has, oh no, that's a issue on there. So other questions.
Can I say something, Nicola?
Super quick, go for it.
I used the advice that's given on the viralkindness.org.au info. I made it very, people had to read it on the Facebook group before they could download the link.
Right. Yep.
And that said, print it and write on it and then give it 24 hours before you deliver it. So I printed it, wrote on it. Before I wrote on them, I washed my hands really well and put gloves on and folded them and then put them into plastic pockets and then put them in the bag I was going to use to deliver them. And then the next day I delivered them wearing a glove for the hand that was taking them out. Okay. For me, I felt comfortable. I was doing everything I possibly could. I delivered them in the morning. People probably didn't get to them till they came, you know, till the afternoon.
Yeah, that's awesome. So just trying the best that we can. Bella had to go, no worries. Oh my God, someone's offering us a quick 20-second song. How good is that? We will definitely finish on that. Okay, so other questions. I'm really aware that there's so many people here and we haven't had a chance to hear from so many of you. Pop your hand up or write a question down or remind me if there's any that I've missed. I'm not seeing hands. People, I think, are probably a little bit full with information right now, or just thoughts and stuff. Yes, I'm seeing some happiness on that stuff. Okay.
I think Katrina's waiting to ask a question.
Yeah.
Oh yeah, no, please.
I've got a question. I posted it in the chat. Just about safety. Like, I live on my own, and I've started up a WhatsApp group with my street. But there's somebody up the road that loiters and does weird things. Like, I don't feel safe around him, and that's an issue with this stuff. You know, there's safety and privacy that hasn't been talked about much, other than sort of viral safety. So I don't want to leave the household out, because there's a wife and kids as well in that household. But how to deal with this stuff, which is very real in a lot of places.
I'm interested in getting a sense. Would people like to do kind of like a version 2 of this call, where we just deep dive a little bit more into some of the practices, some of the systems that we can set up, potentially after that get up call? Is that something? Is there interest in that? Because I feel like that's a big one for me. Yeah, okay, that's good. All right. Well, I mean, we're really happy to host this kind of stuff. On the flip side of the safety, the one thing I also wanted to flag with people is that we're seeing these, large penalties come in. We're seeing the potential of army being put out onto the streets, and it's very unclear the scope of their responsibility. And they're saying that, they don't have the issue with, being able to charge people. But, I can't speak for remote communities in the Northern Territory, but there were communities that were absolutely traumatised during the Northern Territory intervention, and, they shouldn't be having military wandering around without permission of those communities. So I've been asking some questions around, who's speaking on this, how do we advocate for that? And one of the things that I see as a role for these groups as well, and it might be a contentious thing to say, is that yes, I do understand that there does need to be a deterrent for people who are, just like really willfully risking others' health. I get that, but I think that we need to be really careful about the kinds of people that will be targeted, and the kinds of homes that have a lot of people in them who maybe aren't going to be able to do social distancing well. And so for me, I'm interested in sort of starting conversations about sort of like a back to front neighbourhood watch, like kind of a cop watch really, to make sure that in our neighbourhood groups, we're making sure that marginalised people aren't being overly approached and kind of harassed by authorities and stuff like that as well. So I think there's this whole big question for me about it's very goes against the grain for lots of activists to be actively calling for closure of political space, and yet many of us actually do think that a lockdown is necessary. But how do we make sure that the kinds of people that are normally targeted disproportionately by police in those kinds of situations aren't continually targeted? And so for me, that's a really big question. I'd love to talk about what, in the context of what was Katrina was saying about safety, like what does community safety look like proactive safety? And that, to me, when you have these conversations with people, rarely involves police. How do we support each other in those ways while still having that, as a reality in our lives, and the fact that, Katrina needs to feel comfortable about the person that is a bit weird. Like, I've got someone in my apartment that I don't feel super comfortable with, and so it's tricky, how do you negotiate that space when you're trying to build community? I don't have the answers, and I'd really love to have a juicy conversation about it. We're at 3:59. I believe someone has offered to sing for us. I'm just going to give people a very last chance for any last questions. And are people happy to just turn their screens back on really briefly? I'm sorry, there's been so much juicy chat in the group chat that I haven't actually got a chance to answer some of the really good things. So let's make a part 2 of this. But it'd be lovely if we could give our performer a round of applause at the end. Just want to get a bit of a temperature check on how people found the call. Was it useful? Did you hear good stories? Did you learn things? Did you find it good, bad? Okay, great, awesome. And who's our volunteer singer?
Meg.
Or performer? Meg.
Hi. Just a very
Take the
quick.
floor. Anyone can stay and chat if they want to afterwards.
Just a very quick offering from a chorus of women. We write our own music. We often write verses for specific purposes, but this is just a very relevant chorus. We are the people, so many different voices, citizens gather, singing together, we make our home. That's it.
All right, unmute yourselves, everyone, and let's finish with a round of applause for kids and community. Yay! I don't know about you guys, but I found that a real pleasure. Really enjoyed hearing from people, and yeah, really interested in this feels like the start of a conversation, not the end of one from my perspective. One thing I will leave you with as a nice story is there was a news report in WA yesterday of a little dude who's about 7 years old, I think, and he has been doing his own mutual aid project and handwriting letters for people in his apartment block and delivering them to ask if anyone needs help with anything. And so I think that there is, yeah, I see heaps of opportunity in this really difficult time. I know that there are people here that wanted to talk for about bigger picture stuff. And so the last little bit I guess I'd leave us with is that I think that I do want to have those chats. I do think that there is this like window that if we don't allow the disaster capitalism to take over, there's this window where we get to reshape what things look like after this. We're not going back to normal. We're going back to something different. And I do honestly think that in Australia, I'm not seeing people be as brave as they could be. And the grassroots need to push up to the NGOs to help them be brave and to put those, you know, radical ideas on the agenda, like the conversations I'm in about people getting all the kids out of jails in the Northern Territory. You know, decarceration is actually on the table. A universal basic income is, if there's a time to push it, it's now, you know. So let's actually look really positively and see what we can make that's really beautiful that lasts out of this as well. Yeah. So thank you, everyone. Anyone who would like to stick around and chat, you're more than welcome to. And I definitely know there's a couple of people I owe a face wine to. So we can, or we also might have some CounterAct pub parties as well. A few people have been doing that. So if you want to have drinks one night next week on your computer and have a yarn, if you're feeling lonely, get in touch. So yay. Thanks, everybody. Stick around if you want to have a bit more of a chat.
Thank you.
Thank you so much, Nicola.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thanks, everyone.
Thanks,
Thank
everyone.
you. Thanks, everyone.
Thanks.
Thanks, Nicola.
Bye.
Bye.
Oh, bye.
All right.
See you, small person with Fiona.
Say goodbye, Molly.
Oh, is that a dog?
Oh,
was that
Molly.